From the library of the New York Stock Exchange at the corner of Wall and Broad Streets in New York City, you're inside the Ice House, our podcast from Intercontinental Exchange on markets, leadership, and vision in global business. The dream drivers that have made the NYSE an indispensable institution of global growth for over 225 years. Each week, we feature stories of those who hatch plans, create jobs, and harness the engine of capitalism. Right here, right now at the NYSE and at ICE's exchanges and clearinghouses around the world. And now welcome inside the Ice House. Here's your host, Josh King of Intercontinental Exchange.
The dates are enshrined on a little piece of paper that, to me and 193 million other people like me, really means the world. March 3rd, 2021 and March 30th, 2021, the dates that I got my first and second doses of the Moderna COVID-19 vaccine. It meant that I could go out to a restaurant, ride the subway, and work in my office with the degree of confidence that I would not become a victim of the pandemic, or if I did become infected, the chances that I'd be hospitalized or die were pretty damn improbable. Nearly 250 years ago, American soldiers fought for our freedom, and they've been renewing that fight for themselves and on behalf of others at many intervals since. Not to get too dramatic about this, but the men and women in lab coats, soldiers of a sort of the 21st century, have been waging a similar fight in the form of 2.5 milliliter doses of a liquid thawed for an hour at room temperature of between 15 and 25 degrees centigrade and administered in the arm via hypodermic needle. The archetype of the Wall Street blockbuster has evolved over time. The barons John D. Rockefeller, J.P. Morgan, and others have been replaced this year by the disruptor astronauts of Richard Branson, Elon Musk, and Jeff Bezos. What has not changed are the characteristics of competitiveness, passion, self-confidence, and intellect that drives them to accomplish the impossible, and also beat their competition at all costs. The boom and bust, the failure and success of companies who create ideas, manufacture the products, and bring them to market always make for a great story. The library of the New York Stock Exchange is filled with books by and about guests we've had on this podcast, and thousands more whose scientific, industrial, and business exploits we can only have wished to have sat down in conversation. Today, we're joined by the best-selling author of a few of those tomes. Gregory Zuckerman was our guest back in episode 149, which we released nearly 2 years ago on December 16th, 2019, and returns at about the interval that it takes to outline, pitch, research, write, and publish another tract if you don't necessarily take a lot of time to eat, sleep, and breathe. Greg's newest topic, the people behind the biggest scientific breakthrough and global event of that same period, and perhaps a lot more, is his topic of his new book. Greg spent the last 22 months deciphering the scientists behind the major vaccines to the virus that causes COVID-19. Along the way, Greg reveals that often the success in the lab requires the same stamina as success on Wall Street. And fortunately for a lot of us, this group of lesser-known and little-known researchers was up to the task. On each page, Greg lays out the story of their perseverance, inspiration, and ultimately triumph in creating not just one, but many shots to end this modern plague. Our conversation with Gregory Zuckerman, author of A Shot to Save the World, the inside story of the life or death race for a COVID-19 vaccine, is coming up right after this.
The liberalization of LNG is creating a global natural gas market, with freight acting as a virtual pipeline between continents. ICE is home to global natural gas markets benchmarks in Henry Hub, NBP, TTF, and JKM. The nascent liquidity of spot LNG freight markets and the volatility of time charter rates has boosted demand for risk management tools. Now, you can manage LNG freight risk with ICE LNG Freight Futures contracts, which join our global natural gas complex. ICE is the first exchange to list LNG freight futures contracts underpinned by the price assessments of Spark Commodities. Spark 30S covers a route between the U.S. Gulf Coast and Northwest Europe, while Spark 25S covers a route between Australia and China. The introduction of risk management tools for LNG freight will boost the efficiency of the virtual pipeline of LNG. a new catalyst for the liberalization of LNG and a critical milestone in the globalization of natural gas. Make the connection to a global natural gas market at ICE. Get started with ICE LNG Freight Futures today.
Gregory Zuckerman is a special writer at the Wall Street Journal, where he writes about business, economic, and investment topics. He's a 3-time winner of the Gerald Loeb Award, the highest honor in business journalism. Greg's a familiar face on CNBC and the author of several books, including The Frackers, the outrageous inside story of the new billionaire wildcatters, The Greatest Trade Ever, the behind-the-scenes story of how John Paulson defied Wall Street and made financial history, and the subject of his first appearance on our podcast, The Man Who Solved the Market, how Jim Simons launched the quant revolution. He's returned inside the Ice House to talk about his newest book, A Shot to Save the World, the inside story of the life or death race for COVID-19 vaccine. Greg, welcome inside the Ice House.
That was a great introduction. Wow, I should keep that for other future appearances. That was impressive.
I'll send you the document, Greg. Your first visit inside the Ice House, December 2019. At the time, you were in the midst of your book tour for The Man Who Solved the Market. So before we dive into The Shot, I wanted to check in with you on the subject of that last book, Jim Simons. Have you kept in touch with him and the other folks at Renaissance Technologies, famed for their exceptional returns and secretive trading practices, but they've also been experiencing a tumultuous year during the pandemic?
Renaissance is still an obsession of mine, and how they continue to beat the market, and they do with their Medallion fund. There are other funds that are open to public investors have not done nearly as well, but Medallion, last I checked, I think they were up about 40 or so for 2021. They had a very good 2020, not the 70, 80% that sometimes they've seen, but an impressive return nonetheless.
I mean, even if performance was turning around, a lot of the external investors have redeemed from those funds. In July, the firm suffered, I think, $11 billion in cumulative outflows. Your reporting highlighted that many investors were disappointed by the mounting losses and the firm's explanations or lack thereof of what was going on. Are they beginning to attract new investors, or are they going to basically just cave in on themselves and focus on Medallion?
Yeah, it's interesting. Medallion has always done well and continues to do well, but their outside funds have gotten worse over the years. They had a rocky start when they were unveiled in the late 2000s, but then were pretty good performers, and then just the last few years have really underperformed. And investors, as you suggest, have lost their patience and pulled out. And there's also this frustration. Well, how can Medallion do so well and the outside funds not do well? I get into it in my book. I kind of explain how they're very different strategies, but that doesn't mean it's any less frustrating for these investors. And the Renaissance people have also had other challenges. They've had to write this big, huge tax settlement, both interest and penalties are paid to the government because they were caught converting trades that, and they believed they were legal, trades that were short-term in nature, and the government viewed them as having been converted to long-term, and that helped them tax-wise. And Jim Simons himself wrote a check for over $600 million, a personal check, to pay for a lot of the fines and the interest. So it's been an interesting period for those investors and traders over there.
I mean, speaking of the investing strategies that other people use if they're not necessarily using what Medallion is using, I saw a tweet of yours yesterday or so that some indicators suggest that despite this soaring market that we've all been witnessing for the past 12 years or so, all may not be well in the economy. And you later followed that up with a retweet where you comment that many of investors have not seen a bear market in their lifetime. Do you think the under 40 investor with crypto exposure is thinking long-term enough?
I mean, they're thinking long-term in terms of like a week or so, if that's defined as long-term. It depends how you define long-term. It's a fascinating world where, yeah, you had that little blip in March 2020 where things went down, crypto collapsed, and they learned to have those diamond hands, and it's worked out well for them. So yeah, I think I was commenting on a piece a colleague did about how young investors today don't care about financial planning and just buy things like crypto. That's their retirement stake. And listen, it's worked out well so far, but historically speaking, there are bear markets. And as you suggest, I did a story recently saying the bond market is flashing a real red signal. I mean, a flattening yield curve historically has been really a warning sign. So maybe this time around the stock market and junk bonds and crypto is right and the bond market is wrong, but we'll see.
The guy who doesn't need to worry too much about a flattening yield curve is the 83-year-old Jim Simons. Curious, what did you think of the IRS settlement with RenTec? What does that mean for what these headlines that we're seeing about the tax issues of people like Elon and Jeff Bezos?
So in my book, I kind of suggest they probably will get a slap on the wrist for these strategies because they are short-term in nature, these trades, and they converted them through these options I write about into long-term trades. And they got, legal advice and they got approval and all that kind of stuff. But yeah, people internally have been bracing for the IRS to crack down on them. And a lot of them have said, they've been told to set aside money. They have set aside money to pay for these fines and the back interest and the taxes that they didn't pay. So it doesn't come as a real shock to the people there. I mean, they make an argument. It's not a bad argument. These strategies that they embraced, the options, et cetera, the goal wasn't to avoid taxes, but it was a really nice side benefit. So yeah, I wouldn't lose any sleep over that. Jim Simons is still worth over $25 billion and he's still very focused on philanthropy and still healthy, despite the chain smoking. And the guy is sharp as a tack and seems fine, thankfully.
So the last time we were talking to you, you were getting ready to take the life of the author, going on an overseas book tour with your sons to Europe and Israel, January 2020. Are you getting ready to get back on the road? And has the book promotional game changed with the rise of remote options and doing a podcast like you and I are now?
Yeah, it's very much changed, partly because of the pandemic, partly because the book industry has changed and independent bookstores have done nicely, but the real emphasis is on doing things that you can do remotely. And that's media, a lot of television I've done for my new book, A Shot to Save the World, different stations, national and otherwise, NPR and stuff. So there isn't as much of an emphasis on speeches, but frankly, I really love them. So I am doing a bunch of them over the next few weeks, both locally. I'm in New Jersey, in the New York area. I'm going up to Boston and doing some stuff. So I do enjoy it. I frankly love just meeting people and getting good ideas, the back and forth about my new book, but in general, my previous kind of work, I really love it. And even if, a handful of people come, 20, 30 people come, I love the exchange of ideas. So I'm a little bit unusual, but yeah, as an industry, the book publishing industry doesn't emphasize those tours, those traditional tours like they used to.
So let's get into the process for this book. You mentioned that you're in New Jersey now. I mean, you called The Man Who Solved the Market a passion project. The Shot for you really began as a project for you while you were cut off from the Wall Street Journal newsroom, working out of your basement. When did you decide that you needed to start on your next book from the prior book tour? And why focus on a vaccine everyone was hoping for, but at the time you started researching was by no means guaranteed?
Yeah, it's a good question. And my sons, I remember specifically telling me not to do this book. That's part of why I did it. I was still recovering from The Man Who Solved the Market. Jim Simons is the most secretive and his people, most secretive traders, most secretive firm that Wall Street's ever seen. So to get inside there and get people to talk to me was a real difficult challenge. It was emotionally draining. And so I needed to recover, but here we were. So my book came out at the end of 2019. As you said, I was flying around. I was in London doing some speeches in January 2020 and going to see some soccer matches with my sons who were big fans. And then, you come back and by March, we're all locked down. And yes, I was deep in my basement. And basically, I embraced the vaccine chase. Okay, what got me really excited or fascinated was I kept hearing about Moderna. And I had never heard of Moderna. I don't know about you. I don't know. I mean, most of our audience probably hadn't. People in the biotech, those who knew about Moderna in the world of biotech were skeptical about Moderna, most of them. So to the extent that you knew them, you suspected them. There was suspicion about them. There were people that raised comparisons to Theranos. I don't buy into those comparisons. And obviously in hindsight, they proved faulty and unfair, but people compared Stéphane Bancel, the CEO of Moderna, with Elizabeth Holmes. There are a lot of similarities. I can get into them. So there was justification for concern, I would argue. But here I was in my basement, locked down, doing work for the Wall Street Journal, looking for something of a distraction and frankly, some hope. And here I was starting to write about Moderna, this unusual, unlikely company. And they're the ones who are going to come up with a vaccine or among those to save us. It didn't seem likely. You would have thought it'd be the biggest vaccine makers. And frankly, there are similarities to like all my work. So the man who solved the market, it should have been Jim Simons and these scientists and mathematicians who have the best trading record in history. It should have been people who actually care about trading and business and investing, and they don't. So I really grabbed onto that theme, and it gave me hope that these people were working hard on a vaccine, and I wanted to track them and chronicle their efforts along the way.
I mean, both your journalism and your long form writing are known for their exhaustive research methods. When you and I talked last, you told us about how you visited the childhood home in Newton of Jim Simons and used pictures of it to try to get him to talk to you. Moderna, also in my hometown of Boston. Did your process have to change to accommodate the pandemic? And were you able to accomplish this from home and get people to say, hey, let's get on a Zoom call and I'll tell you everything? I heard on one of your podcasts that, at least from a sourcing standpoint, people were free and easy with everything that they had.
So in some ways, it was a lot easier than the man who solved the market or my past work running my finance. In some ways, it was a lot harder. It was a lot easier because people in the world of science love to dish, and they don't do the whole off the record on background. Greg, I can tell. No, they just talk, generally speaking, and they will critique each other. And that's the scientific process in some ways. And there are characters in my book who are outright cruel to each other publicly. There's a guy at Oxford University, Adrian Hill, who's known for just getting up at conferences and just ripping into the work of colleagues and other scientists. And there's some people who say, Greg, that's just how it is in our world. And that's how you get to effective drugs and vaccines. The only way we can do that is through people kind of being very critical of each other. So as a result, they were more likely to talk to me. Yeah, they didn't do the whole kind of I'm a hedge funds and I'm not allowed to talk kind of thing. The flip side is that I love getting out there and talking to people and setting a scene and experiencing. And that's part of the joy of writing a book. At the Wall Street Journal, where I am day to day, there's just not as much opportunity. Unfortunately, we're writing a newspaper. There's not as much opportunity to spend, weeks traveling and meeting people and getting out there. For my book, The Frackers, I went to like little towns in Oklahoma and Louisiana and Texas. And it was such a joy to meet people who aren't like myself and get that perspective. So for this one, I was locked down and I had to get inside RenTec. I had to talk to people that went to school with Ugur Sahin, the CEO, and grew up with him and started the company with him. And here I was in my little basement office. So that was a challenge. And same thing with Oxford University. So, but, enough persistence and knocking on enough doors or as it is, calling people, reaching out to people, you get to enough people. But that took a little while.
The book begins this cast of characters that make up the drama of the next 340 or so pages of the story. One or two of them have become household names like Dr. Anthony Fauci, but the rest, and you've mentioned some of them already, were and kind of remain out of the limelight. How were you able to actually identify the people working behind the scenes and get access to them during a time when many were working 18 or more hours a day on their main job, which is to roll out this vaccine?
Yeah, it's a good question. I really did not want to interfere with their work. Their work is much more important than mine. They're actually saving lives. So I was conscious of that. But I also think that talking to me in some ways was a real enjoyable distraction for some of these scientists who changed the world. And they realized they were part of something historic and they wanted to share their thoughts about early work within Moderna, within BioNTech, within some of these efforts that I write about that hasn't been acknowledged. And frankly, that was a challenge too, because people on the outside, the scientific world, the academics, the government scientists, they're a little dismissive, frankly, of the work that's done in private industry within the companies like that I write about, Novavax and BioNTech and Moderna. They kind of say, well, yeah, then they figured out delivery, which is basically getting mRNA into the cells, into the right place without making sure that it gets there and these jumping ahead. But mRNA, this vaccine, this changed everything. It's encased in what they call a lipid nanoparticle. It's kind of fatty substance. And it needs to be encased, and that gets you into the cell. But people on the outside are like, well, yeah, they came up with some lipid nanoparticle. But to me, I said, well, hold on a second. Somebody must have been responsible for that breakthrough. Somebody within Moderna. Who is that person? And quite honestly, the senior people didn't always know. It had been done maybe years earlier. It wasn't a high profile scientist within the company. So that took some research. But my instincts were that there was work, breakthrough work, that has saved lives that hadn't been focused on. And that was my goal to really, my book is really about in some ways the average kind of scientist within a company, within a government agency, within somewhere who's done breakthrough work that hasn't really been properly acknowledged.
The story that you've laid out is put in a timeline. Really, it could have started in 1961 with the discovery of mRNA, or even a whole lot earlier in 1869 with DNA. Why instead did you decide to begin the same year that you started investing your bar mitzvah money into low PE stocks?
I really focus on HIV early on because the chase for an HIV vaccine I found fascinating, and there are a lot of parallels. And I, as a layman, I was struck by how many people said, well, we learned this with HIV, and yes, we're working on COVID, but we're using some of the same tools that we did for the AIDS vaccine. And I'm like, wait, AIDS vaccine, we haven't found one yet. That was an absolute failure. And people are like, no, Greg, yeah, we don't have a vaccine yet, but we learned so much about the immune system, about how to conduct trials, about this approach. It's called the adenovirus approach, which I write about in my book, which eventually has led to effective vaccines. That's the J&J vaccine. That's the AstraZeneca vaccine. So for me, I was just fascinated by how you've got to trace it back to that era with HIV, but also, frankly, there are a lot of same characters. I mean, you talk about Fauci. It was a huge presence in the chase for HIV vaccine. A lot of the same people are. It's almost like they got the band back together. And the same thing with mRNA. So I go back to really work by this guy, John Wolfe, in the late 1980s at University of Wisconsin. He was just a fascinating individual. And yeah, he in some ways, I think, is a pioneer who hasn't been acknowledged for his work on mRNA. And he didn't figure it out. And in some ways, it's a bit of a relay race where he and others run a lap or two and make progress and feeling good about themselves. And then they stumble and fall and they barely pass the baton to the next group and they pick it up from there. And I find that process fascinating, different characters. And it's important to acknowledge that there's no eureka moments when it comes to this stuff. And you need to know a little bit of the history. So that's why I go back that far.
Talking about history, HIV through therapeutics and other preventative treatments makes that virus not the scourge that it once was, but it still doesn't have a vaccine for it. How did issues with places like microgenesis and money impact how people like Dr. Fauci and others had looked at upstarts like Moderna initially?
My book's about science, obviously, but it's also about money, and it's about financing. It's about Wall Street. It's about entrepreneurs. It's about attracting the right amount of financing. I mean, biotech world is, as we all know, it's a fascinating world with a lot of home runs and strikeouts. And the ability to raise money is just as important as the science in the labs. And frankly, we're jumping ahead a little bit. But yes, the COVID vaccines, I would argue, are modern science's greatest achievement, but they also may be modern finance's greatest achievement. And I'll talk about it later. I'd like to get into it. But were it not for Wall Street writing big checks at the right time, Moderna would not have been able to manufacture these vaccines. So yes, I go back when it comes to HIV and I talk about this company, Microgenesis, which at one point was in the lead and it was a biotech company and just a really interesting upstart. And they were raising money and they kind of ran out of money. And the point being that financing is just as important as the science.
You said that, I think at some point, I write the same story of book after book of unexpected and unlikely people triumphing over seemingly impossible odds. A Shot to Save the World, Wall Street comes across really as one of the unsung heroes of the success. Has the reaction to that been surprising from your readers?
Yeah, listen, most people instinctively have a negative view of both big pharma, little pharma, medium pharma, and Wall Street. And no one really thinks about the fact that for years, venture capital firms, sovereign wealth firms, individual investors are plowing money into some of these companies I write about, Moderna, Novavax, BioNTech, with just the hope of profits down the road. And frankly, we're the only country that has that ecosystem. You know, at the Wall Street Journal, I'm a big believer in capitalism. It's not the ideal system, but it's the best one we've got. And I've talked to the CEOs and executives and scientists within these companies who are many times foreign born. And they all say without American investors, there's no way these vaccines could have been produced. So yeah, Wall Street, I do believe, should get some credit, as should big pharma. It's not to say that people like me shouldn't scrutinize both. And there are mistakes that are made and there are bad people in every industry for sure. But let's give credit where credit's due.
So let's give credit where credit is due. We're going to dive into a lot of these players in A Shot to Save the World after the break. Greg Zuckerman and I will continue the conversation about his new book coming up right after this.
ICE is home to liquid global energy markets, including the broadest range of natural gas benchmarks from the US and Canada to Europe and Asia.
Natural gas markets are globalizing, driven by new LNG dynamics. The relationship between Europe and Asia is taking center stage in natural gas price formation. In Europe, we provide access to the two leading benchmarks, NBP and TTF.
In Asia, the Japan-Korea marker is the benchmark for pricing Northeast Asian markets. Focused on South and West Asia, ICE's West India marker LNG futures contract supports growing natural gas demand in India and the Middle East.
Against the backdrop of the U.S. shale revolution, market participants have become refocused on regional, physical, and financial gas markets. In North America, we offer the most comprehensive collection of locations and liquidity in the physical and financial gas markets.
ICE offers the most comprehensive complex of global natural gas benchmarks. These deep and diverse markets allow for transparent pricing across the globe.
Welcome back. Before the break, Greg Zuckerman and I were discussing the process leading up to his most recent book, A Shot to Save the World, and checking in on the subject of one of his prior books. Greg, as information about a possible vaccine spread in 2020, most of us were just trying to access our biology 101 memories about DNA and RNA while you're driving deep into the research. Can you explain, like we're all 5 years old, what makes mRNA both an appealing but also an elusive agent for the delivery of this vaccine?
I can, because it's easy for me because I'm a layman myself and feel like Michael Scott half the time where I ask the scientists to kind of dumb it down for me. So yes.
But you're kind of a big deal, just like Michael Scott.
In my own mind, yes. So yes, mRNA is a molecule. We all have it inside of us and we depend on it. mRNA carries the instructions from DNA to the part of the cell where proteins are created, proteins that keep us alive. And mRNA and DNA can't do it itself. DNA needs to hand the message, the instructions over to mRNA. And mRNA has the name messenger because it is that messenger. And it's valuable and it's also very unstable. It gets chopped up within moments by the cell's enzymes, such that it's really short-lived and yet valuable. And people always, in the world of science, they always had this dream. Well, geez, if mRNA can make proteins, can tell the cell to create certain proteins, what if we created mRNA synthetically in the lab and put it in a vaccine or in a drug? Couldn't we tell the body to create any protein we want? And why is that important? Because then you could create any kind of drug or vaccine that you wanted. And it was always like this holy grail. Oh, yeah, someday, what if we could do it? But then most scientists kind of said, well, yeah, but who wants to make a big bet on mRNA? As I said earlier, it's short-lived. It gets chopped up. It's very unstable. And also the body's immune system has defenses against it. It recognizes mRNA and it's on the lookout for mRNA and it doesn't want it to invade the body. So it was one of these things, like it was always a dream of scientists to create a drug or a vaccine based on mRNA. Again, because then you could tell the body to make anything. You could teach it to create any kind of protein. Why is that important? Because a vaccine is an education. You're teaching the body's immune system to recognize some pathogen, some virus, something that then it could experience in the future. So if you can teach the body to create a certain protein, let's say cancer, that's what Ugur Sahin and BioNTech was doing. Well, I'm going to use mRNA. I'm going to tell the body to create a certain cancer protein to educate the immune system. Whenever you see that protein in the future, we're going to go destroy it. We're going to go fight it off. And the same thing with viruses and other pathogens. So it was always the dream, was always the hope to create mRNA in the lab as part of a drug or a vaccine. But most people sort of didn't want to waste too much time on it. And then there were the stubborn scientists that I write about in my book who ignored the conventional wisdom.
Yeah, so let's get into some of those stubborn scientists. I mean, the elusiveness of the mRNA molecule turned so many away from focusing on it. But some of these zealots, they marched on, like Katalin Karikó, the Hungarian-born researcher. It's a completely different world, but she kind of reminded me of some of the drillers from the frackers. Did you see that comparison? And how did her steadfast belief in the mRNA molecule provide the infrastructure for several of the vaccines, including the one from BioNTech, where I presume she was finally rewarded for her work?
I think it's a great comparison because the same kind of thing where people in America and everywhere, geologists always said, well, yeah, there's a lot of oil and gas in shale. It's just this rock deep down below the surface. We all know there's a lot of oil and gas in there, but don't waste your time after trying to get it out. It's too deep, too expensive to get it out. And a few stubborn, persistent wildcatters, frackers, I call them, said, we're going to ignore the conventionalism. Same kind of thing here, where conventional wisdom is don't waste your time in mRNA. It's unstable. It doesn't last long, yada, yada. And Katie Carrico, this scientist at UPenn for many years with her partner, Drew Weissman, and others I write about, they ignored that conventional wisdom and they proved the skeptics wrong, but it took years of stubborn persistence. And basically what Carrico and Weissman did was figure out that if you just tweak the chemical basis of mRNA, there are, nucleosides that make up the backbone of this thing. If you just make a couple of tweaks with something called uridine, you switch it for pseudouridine, you can actually get mRNA into the body cells and avoid the immune system's defenses. And then once you're in the cells, you can deliver instructions to the body cells. And it was groundbreaking stuff. And it took them years. And she overcame so much. I mean, her colleagues, her bosses at UPenn, people in the industry, they mocked her. They discouraged her. Weissman too. And even after they wrote these groundbreaking papers, they couldn't raise money. They couldn't get any headway in terms of starting a company to actually make a drug or a therapeutic. And frankly, their work was kind of overlooked and forgotten. And it took some scientists I write about in Cambridge, Massachusetts, who eventually led to Moderna, who rediscovered this paper. It was almost like the Rosetta Stone had been buried. And then they were like, wait, hold on a second here. Let's dig this thing up again and use it. And I think it's important to understand that, like Katie Carrico and Weissman, as important as their work was, it didn't lead to anything. And we needed other people to pick up that baton and go back to running. So there are a lot of parallels with these stubborn people I write about. And I do have an affinity for people who believe in themselves, who have an approach that conventional wisdom dismisses, and they overcome all kinds of odds. I think there are a lot of life lessons we can learn from that.
Carrico and Weissman are what make this story so human, despite it being very complex and scientific. You introduce like every new character with an intricate level of descriptive detail and describe, in many ways, the banal activities behind major scientific breakthroughs, like the scramble for access to a copier or a 4-hour cup of coffee between colleagues. Why is knowing the people central for us to understand the story of this very complex scientific breakthrough?
So I do it for a few reasons. Partly my strategy in my writing is a spoonful of sugar helps the medicine go down. So in other words, this is intricate, complex biology and vaccines and therapeutics. And I want it to be also entertaining. If you're going to invest, hours in a book of mine and the money in a book of mine, I want you to both be educated, but also entertained. It should be a fun read too. And that's what I do with all my writing. I mean, I wrote about CDO contracts and CDS derivatives in my first book, and geology and fracking in the second, and algorithms in the third. So it should be a fun read at the same time. But also I do it because I don't think the human side of science has been written about enough. And these are fascinating characters in their own right who are competitive and jealous and envious and neurotic and ambitious and resilient and persistent. And we can learn all kinds of lessons, I think, and while being entertained. So the pressures that they feel to raise money, I mean, money kept coming throughout my research. I frankly hadn't been aware of it. The woman who leads a lab, the postdoc, who's got pressures about their career. They got to get a paper. They're looking over their back. Someone else is writing the same kind of paper. They hear about somebody in Germany doing the same kind of thing. I write about it over and over again in my book. And listen, we all have some of that in our own lives. I'm in a competitive business. We all do. All your listeners are. But I think it's important that people understand the same kind of things. The emotions also are very prevalent within the world of science.
Let's talk about the world and emotions of Stéphane Bancel at Moderna. At the time of this recording, Moderna's vaccine for children is still pending approval, and some have reported that the holdup is due to additional requirements the government is asking for them that have really little to do with the efficacy or safety of the dosage. What did you find concerning about the friction put on Moderna's progress by Operation Warp Speed, despite the company was using Wall Street and not the government for funding?
So first, let's talk about Bancel and his company, because they're quite unusual and unique and quirky in their own right. So basically, Stefan Bancel is not a scientist. He's a Harvard MBA grad, an engineer. And he had this vision. He believed in mRNA, and he had to convince others. And he was a very persuasive guy. And he raised billions and billions over the years. And people were very envious and jealous within the world of biotech. How is this guy, this outsider, able to convince so many people? And Moderna was a very secretive company, and people were suspicious. People made accusations suggesting maybe a Theranos kind of situation was going on. And his own people, former employees, were critical of him. He's a very difficult boss often. High expectations. People collapsed in the office, outside the office. I write about it in the book. At home, from exhaustion, trying to keep up with Bancel. He fired lots of people. But to his credit, he had this vision. He believed, and he told his people, hey, someday we're going to be the ones to step up in a crisis and to save lives. And he persisted. And right, so here they are, they go into 2020, they create an effective vaccine, and they don't have enough money to produce it. And Bancel, this ultimate salesman, he goes and tries to sell the effort to the government, to Merck, to foundations like the Gates Foundation, trying to raise money, trying to get a partner, and no one wanted to work with them. We're talking about May 2020. And they're apoplectic. They're despondent, people within the company. Here they are. Can you imagine they developed what they think is an effective vaccine, but they don't have money to produce it. And the government, you're right, at that point, the government early on, Warp Speed was a great idea. It's a lot of good. We can get into it if you want. But its first bet was not on Moderna. It was on the Oxford AstraZeneca effort. So that forced Bancel to turn to Wall Street and turn to Morgan Stanley in particular. And they raised all kinds of money. Bancel told his people, take this money and go, start spending. And they did to produce these vaccines. So there was a lot more drama behind the scenes than I had expected. I mean, we were very close to not having Moderna vaccine. We're very close to not having a Pfizer vaccine. I mean, BioNTech went to Pfizer. Ugur Sahin, the CEO of BioNTech, went to senior executive Phil Dorwitzer at Pfizer early on in 2020 and said, hey, let's work on a vaccine together for this new coronavirus. And Dorwitzer's like, yeah, I don't think so. Don't waste your time. These things dissipate. So I don't think we were appreciative enough of how easily it could be that we wouldn't have either of these vaccines.
I mean, for the most part, Greg, the U.S. government, despite unprecedented levels of monetary support, really allowed the free market to develop the weapons to combat the pandemic. In addition to the majority of the people in your book who laid the groundwork, like Maurice Hillman, or developed the shot, all seem to embody, in some ways, the rugged individualism that the Western world cherishes. On the other hand, combating the pandemic was the most effective in collective or state-dominated countries. Why is that dichotomy that you wanted to show in the book play out?
Yeah, that's exactly right. So when it comes to preparing for the pandemic, reacting to the pandemic, we were awful. And there's a lot of lessons to be learned. Even the rollout early on was not the smoothest it could have been. So when it comes to discovery, when it comes to scientific advances, I think you do need maybe this rugged individualism, or at least kind of stubborn scientists, resilient and persistent. But when it comes to public health, we need both private and public sectors to work together. They really did for the vaccines. NIH worked closely with Moderna. There was the Operation Speed money, which was very crucial for a lot of the efforts. And there were other resources. There were all kinds of resources that the government, Operation Warp Speed, helped provide for the different vaccine efforts in terms of the manufacturing, et cetera. But everything else, we were hobbled by lack of cooperation, by skepticism on the part of citizens. It's very discouraging for the scientists I talked to who worked on these vaccines to see how many people are still wary of them. And yeah, there are lessons I think that can be learned from other countries where people did defer to scientific leaders, experts. And here we treat everyone with suspicion. That's America, right? So there's a lot of great things about our country, this rugged individualism, like you said, and this whole DIY, I can do it myself. I can figure it out. I can ignore the experts. That works sometimes, but it often doesn't.
I mean, you wrote that Bancel is now focused on healing Moderna from the experience that pushed the limits of both the humans and technology at the firm. That doesn't seem to be an issue for Ugur Sahin, the co-founder of BioNTech, who pivoted his life work from defeating cancer to focusing on COVID. Sahin's has rewarded himself with this daily 30-minute walk for his vaccine success and got back to working. How did Sahin's cancer experience reflect how different disciplines were leveraged to meet the growing COVID pandemic?
Yeah, well, to address your first point, that's a really good observation that these companies have reacted in very different ways to the experience of the past year. Bancel and Moderna didn't have a partner. They worked with the government, that's true, the NIH, but they didn't have somebody like a Pfizer. And they tried, they reached out to Merck and Merck wasn't interested. So they had to do it on their own. And as a result, they're overwhelmed. And, some people would say, well, yeah, but they're billionaires now and they own a lot of stock. So how much sympathy are they going to have for these people? And it's big pharma. But I don't feel that way. I have talked to these people and they're dedicated. People dealing with cancer, stage 4 cancer, keep coming into the office. And there's a person I write about in my book, Juan Andres, who's the head of manufacturing, who beats himself up on a daily basis because he feels they could have done more. They could have produced more vaccines and reacted quicker, and they're disappointed themselves. And as you say, they're emotionally shot, a lot of these people, because they've been going all out because they are a relatively small company. And they've had to, it's been very difficult for them. And that's the goal of some of the top executives at Moderna this year, to comfort and to ease their pain and to get people back to normal. And these people have really been working without a break. Whereas the BioNTech people, because they had this partner in Pfizer, they have been much less psychologically damaged. If anything, it's been an uplifting experience, both helping people, but now they've got billions of profits that they're plowing into new areas like cancer and other kinds of areas. And just like we are able to turn on our immune system, maybe we could turn it off with things like MS or lupus, something like that. So as you suggest, Ugur Sahin is not, what's really fascinating is that he's not an mRNA guy. He's not an infectious disease guy. His whole life is dedicated to cancer research. And frankly, he hasn't made that much progress there. mRNA was one method he was using to try to address cancer, and they haven't proved it yet. And yet they made enough progress with mRNA that they were able to turn on a dime in early January 2020 and produce these vaccines. But in some ways, this is just the first chapter in a long book for him, hopefully, where now he can take these billions and finally make progress on cancer, which is his original goal.
Talking about the long book still to come, you're telling us the story of how in the days of HIV, vaccine research was viewed sort of as a dead end and not worth the effort or focus. There's even the example of HIV researchers hiding their work from their superiors. Why was that? And do you think the industry is now going to change, not just with the COVID-19 success, but Moderna's growth as a vaccine-specific company?
Yeah, I do think it's changed. So yeah, historically, vaccines were kind of a loser business. Yeah, they got a lot of publicity and people like, Albert Sabin and others are household names. But the average vaccine until last year, took 10 years to develop. The fastest one ever was 4 years, mumps. Time and time again, I write about researchers making progress on vaccine shots for things like MERS and the first coronavirus, SARS, things like Zika, et cetera. And then they peter out, they dissipate. They've spent all this time working and money spent devoted to these vaccines. And then we don't even need them anymore. And it's just not a profitable business. Also, there's just so much you can charge for a vaccine, whereas a drug, you can charge more. Vaccines are given once in a blue moon, whereas a statin or something is kind of a daily medicine. So historically, no one really wanted to go all out in vaccines when it comes to in the pharma business. That's partly why HIV vaccine was left to both government researchers, but also some of the upstarts that I write about in my book. So vaccines were not viewed as a really promising area until this past year. Now, Pfizer, BioNTech, Moderna, the stocks have soared. Even Novavax. Novavax is going to have a vaccine soon, but the stock has gone from like 3 to over 200 over the past year and a half or so. So I do think we've opened up the money and the resources and the interest for a new era for vaccines, which is wonderful for us all. And again, these researchers are now pivoting to all kinds of new areas that could benefit society. So I don't want to say I'm confident, because historically mRNA and some of these other methods haven't made much progress with drugs and with vaccines, partly because you needed to target certain parts of the body and it's hard to do that. I think they can maybe overcome these obstacles. So I'm optimistic.
As we wrap up, I mean, the week that we're recording this is the hubbub around Aaron Rodgers and the comments that he made earlier that he had been immunized, and the way this is dividing, like so many other issues, people on either side. But, I've heard some of your conversations about how, you do want to, reassure people that, look, this is not an overnight thing. This is actually decades in the making. What do you make of where sort of our culture is sort of divided down the middle? And we're in Scotland at COP26 thinking about how to save the world from an even bigger problem of climate change. Are you optimistic that we can get over sort of this distrust of one another?
So for my book, The Frackers, I said I traveled all over the country and I got to know people who are very unlike me. I'm an East Coast guy. My wife's from LA, so I guess we're two coasts, whatever. And one needs to. We don't have enough opportunity to meet other types of people today, sadly. And I remember once I was at a breakfast, and Michael Bloomberg made a really interesting point about why this was years ago, but why in Washington, D.C., there's such divisiveness and anger and bipartisanship. And he made an interesting point that part of it is because transportation has improved so much in our country, meaning that Congress people go home on Fridays to see their constituents, go to their families, et cetera, as opposed to having to be stuck in Washington and grabbing a beer with each other, grabbing a cup of coffee, having a meal, getting to know each other. And yes, that's the case today as well. With every topic of importance, everything is just divided and people are unlikely to listen to each other and to form opinions that, maybe that they could have been wrong, and they're open to others. So am I optimistic? I'm really not, sadly, but I guess I was, though, reassured that we still have these remarkable people in America, often researchers, entrepreneurs, willing to take big ideas and embrace them and try to change the world. So, when you talk about climate change, maybe we're not going to all come to some agreement, but maybe the solution will come from some lab somewhere in America, some overlooked approach by some stubborn scientist who right now is being dismissed, but has a solution. Maybe it's extracting carbon from the air, something like that. So that's where I'm most optimistic in the entrepreneurs and the innovators and the scientists. And my book, my research for my book has reassured me about those individuals.
I mean, so then let's end this podcast, Greg, the same way that we ended the last time you and I chatted about your prior book. I know that you've expressed interest in General Gustav F. Perna and the others that you are not able to cover in this book. Have you begun to think about the topic of your next book, and as a follow-up that looks at Operation Warp Speed and the efforts to disseminate the vaccine across the planet, perhaps on the table?
It's interesting. I have thought about digging into some of those issues a little bit more. I have an idea, which will probably be more a really good story for the journal that I'm very excited about. But first, I want to let people know about this story. So I'm going to focus on this for a little while, and hopefully people enjoy a shot to save the world and learn the life lessons that I did. I mean, I do these books in some ways. I'm selfish. I like to learn from really fascinating, smart, quirky individuals. There are life lessons that can be learned. There's inspiration I got from these, their innovations, and their stubbornness, their self-confidence, and their persistence. So it's something that I took from it, and hopefully people do as well.
Well, if you keep your pace up, we'll see you in 2 years' time, November 2023, for whatever comes next from Gregory Zuckerman. Thanks so much for joining us inside the Ice House.
That was a lot of fun. Thank you for having me.
And that's our conversation for this week. Our guest was Gregory Zuckerman, special writer at the Wall Street Journal and author of A Shot to Save the World, the inside story of the life or death race for COVID-19 vaccine. If you like what you heard, please rate us on iTunes so other folks know where to find us. And if you've got a comment or a question you'd like one of our experts to tackle on a future show, email us at icehouse@ice.com or tweet at us at IceHousePodcast. Our show is produced by Pete Ash with production assistance from Stefan Capriel and Ian Wolfe. I'm Josh King, your host, signing off from the library of the New York Stock Exchange. Thanks for listening. Talk to you next week.
Information contained in this podcast was obtained in part from publicly available sources and not independently verified. Neither ICE nor its affiliates make any representations or warranties, express or implied, as to the accuracy or completeness of the information and do not sponsor, approve, or endorse any of the content herein, all of which is presented solely for informational and educational purposes. Nothing herein constitutes an offer to sell, a solicitation of an offer to buy any security, or a recommendation of any security or trading practice. Some portions of the preceding conversation may have been edited for the purpose of length or clarity.